Good morning, and welcome to the SSHCO's Fall Town Hall. Well, I'm Kimberly Hobson, the proud CEO of the Southside Healthy Community Organization, and if I seem excited this morning, it's because I am. I'm always thrilled when we can come together, members of the community, patients, partners, donors, board members, and staff to learn about each other. And so from us, you'll learn about the services SSHCO offers and the impact we're creating with our partners across the South Side. And we hope to learn from you the questions you want answered, the needs you're seeing, and where we can do even more. So drop your questions in the chat as we go along this morning. So first, I'd like to have one housekeeping item. If you'd like to turn on your captions, please click the CC button at the bottom of your Zoom screen. This feature also supports translations in Spanish and other languages. Now, we have a packed hour ahead with new data, new voices, real stories from people we serve. We also have a fun activity plan and the chance to win swag. So stick around with us. Now, I say this every time we have one of these town halls, and I really mean it. This work is personal for me. I was born right here on the south side of Chicago in Auburn Gresham, and I've worked in healthcare on the south side of Chicago for almost all of my career. I've seen what happens when health systems are fragmented and they don't meet patients' needs. And that's why SSHCO exists. We were created as part of the state of Illinois' Healthcare Transformation Collaborative Initiative to improve health outcomes, reduce health disparities, and realign resources in distressed communities throughout Illinois. Too many people are not connecting with their primary care providers. Too many expected moms don't have the care they need. And too many people are struggling to manage their chronic conditions, and they're doing this all alone. And so we also know that none of those problems can be solved with medicine alone. That's why we look at the whole picture, from food, from housing and transportation, and more. And I'm enormously proud to say that it's working. It is actually working. It's been nearly 4 years since SSHCO launched. And in that time, we've grown from one idea, just an idea, to a thriving, healthy community model. We started with a few key items, few key ideas about how health and wellness should work. And in a short time, we have proven them to be true. And so the first key idea is that you have to meet people where they are and you have to stay with them. Care only works when people can access it and they can trust it. And so that's why we go beyond the clinic walls and actually go into the community. We meet people where they are. We literally meet them where they are because we know health starts long before you get to the doctor's office. We serve residents across 15 zip codes on the South Side, primarily those who are on Medicaid and don't have insurance. We now have a presence in 21 clinics and emergency rooms across the South Side where patients find us and get our support every day. But we also go into the community. We go to community centers, we go to events, and we go to churches, we go to patients' homes even. We're on the street knocking on doors to find patients that we know need our services. And so what does this actually look like? What does this look like in practice is what you might ask. And so since we launched, the SSHCO has screened over 18,000 residents. We've enrolled more than 6,400 in our care coordination programs. And that means we work with these patients' doctors, their nurses, and other providers to share information and prevent gaps in care. Nearly 2,000 of those patients are actively being supported by our teams right now. We've coordinated nearly 5,300 healthcare appointments, delivered thousands of rides, and referred people to food, housing, and support services and systems across the 15 zip codes that make up the South Side of Chicago. In fact, we've even made more than 2,700 referrals to address health-related social needs. And the total number of completed appointments by the providers that we actually subsidize is now more than 138,000. Wow. That really means that our care coordinators have been really busy. But that's just the beginning, because all of those things have created a ripple effect for more impact. And that leads me to the second idea that we've proven to be true. And that is that care is important, but coordinated care produces even better outcomes. You can connect people to services or appointments all day long, but if you're not coordinating the various aspects of their health and wellness, you're not giving them the customized approach they need. If someone finds out that they have a chronic condition, they may need to regularly see a specialist in addition to a primary care doctor. And if someone gets a clean bill of health from their primary care doctor, but they don't get their screenings, then they can also slip through the cracks. We coordinate all of their care so they don't get overwhelmed or lost in the ecosystem. And it works, you guys. It actually works. People in the SSHCO care programs are getting healthier, and they're getting healthier faster. For example, a patient who joins the SSHCO, our care management programs, they are much more likely to get their blood pressure or their diabetes under control within a few months compared to similar residents who aren't enrolled. For blood pressure, which we know is a silent killer, about 40% of SSHCO participants got their blood pressure to a healthy level versus 25% in a comparison group. Now, they were also about 1.5 times more likely to get their blood pressure under control within 120 days. Now let's talk about diabetes. Nearly 39% of SSHCO participants reached a healthy A1C level compared to about 21% of others, which is a clear sign that the program helps people manage diabetes better and faster. And that has all kinds of implications for their long-term health. Now, the third idea we have proven is that SSHCO can be a model for how we operationalize social health. I'll tell you what I mean when I say that. Everyone talks about the social drivers of health, like housing, food, and transportation. But SSHCO is one of the few that are actually hardwiring them into the healthcare experience. We've moved beyond awareness to action, embedding social supports into care plans, visit workflows, and follow-up protocols. So it's not just a handout for someone to read. It's a holistic system. Here's what that looks like. We've helped 177 individuals and families get into stable, permanent housing, and the results speak for themselves. Emergency room visits have dropped for those individuals, nearly 60%. Hospital stays went down by half. Most residents were housed in just 44 days. And we know that without stable housing, people can't stay healthy. It's just that simple. They can't. In other words, giving people a safe place to live isn't just the right thing to do. It makes them healthier, actually saves more money, and it makes the healthcare ecosystem work better. Now, let's talk about transportation. In 2025 alone, the SSHCO delivered over 2,800 rides to appointments because access only matters if you can actually get there. Now, last but certainly not least, the fourth idea we've proven out is that this approach isn't just good for patients. It builds a stronger ecosystem. And so we're not in pilot territory anymore. These are embedded services backed by real data, delivering measurable, sustainable outcomes. And none of this happens without our partnerships and without the state of Illinois. That's why I'm thrilled to introduce someone who has been a champion for innovation in healthcare across Illinois. Please join me in welcoming Nancy Tao. She is the Director of Healthcare Transformation Collaborative for the Illinois Department of Healthcare and Family Services. I am so happy to introduce Nancy. And Nancy, we're so glad to have you join us.
Thank you, Kimberly, and good morning, everyone. I'm Nancy Tao with the Illinois Department of Healthcare and Family Services, and it is a privilege to be with all of you this morning. Kimberly, the results you just shared are really exciting, and I think it really speaks to the work that we're trying to do at HFS. In 2021, we launched the Healthcare Transformation Collaboratives program with a vision to reimagine care and improve health outcomes by breaking down silos between organizations to provide care that is centered on the person and not on the institutions. On the South Side, as you all know, that mission has a lot of urgency. According to data from the City of Chicago's Department of Public Health, in 2022, non-Black Chicagoans had an average life expectancy of about 81.2 years. But for Black Chicagoans, life expectancy was 69.8 years, a gap of 11.4 years. In West Englewood, life expectancy was just 63.9 years. And the primary driver of that life expectancy gap is chronic disease, conditions like diabetes, cancer, heart disease. Chronic disease contributes 4.7 years to the life expectancy gap, or about 41% of the total. And that disease rate doesn't exist in a vacuum. It exists in the context of neighborhoods and communities and the types of resources that individuals in these communities have to address their holistic health needs. That's why SSHCO's work matters so much. SSHCO is facilitating stronger connections between primary care and specialty services, and it is attracting more specialists to serve the South Side. SSHCO is embedding community health workers directly in clinics, ERs, and in neighborhoods. So these are folks that are not just responding to acute health needs, but they're helping people to stay well and to prevent further disease. At HFS, we not only funded collaboratives like SSHCO to initiate and establish these kinds of services, we're also working to create a path to billing for non-clinical work, like the work of community health workers and housing and nutrition services, so that organizations can earn revenue for these critical activities. We're excited to see data like fewer avoidable ER visits and more utilization of outpatient services. That tells us that things are moving in the right direction. And we hope that collaboratives like SSHCO can prove that a coordinated, community-rooted approach can deliver measurable healthcare results that are scalable and replicable across the state of Illinois. So know that HFS is cheering you on. I know the road has not been easy because it's always challenging to change the fundamentals of our day-to-day work. And especially right now, I know that your organizations are facing tremendous pressure and uncertainty to be able to continue offering critical services to your clients and community. My hope is that a model like the SSHCO Healthcare Transformation Collaborative can shine a light on the path forward, that it can show how institutions coming together to share resources and to work hand in hand can ultimately generate more value collectively and sustainably. So thank you to everyone on this call for being a champion for health equity and community care. And thank you for building a healthier and more resilient South Side.
Thank you so much for that, Nancy. We can't do it without your support. Now, the numbers tell an important story, and so do our patients. We'd like to share a brief video where you can hear directly from one of our patients about the work of SSHCO and its partners, how it's changed her life. Like so many people we work with, Jayla felt a connection with her community health worker and was able to build a sense of trust. So let's hear it.
I'm 18, going on 19. I am currently on the south side of Chicago. I told you I needed services and like job placement, things like that. And they connected me with Charlene like the next day. She made me feel safe for her. She made me feel like, like I could just tell her anything and what I'm saying, she would help me. You know what I'm saying? She would support me. And that's kind of I needed the support system and she's that. Like I'm a person that like I don't trust very easily and she kind of like made it very easy for me to trust and it was just, it was a good experience overall. So that's why I would recommend and that's why I will vouch definitely. When I met Charlene, I was going through one of the hardest times of my life. No stable place to stay, no real support system, and just trying to hold everything together. Charlene just did not hand me resources. She became one. She checked on me, followed up, made calls, explained things that no one else took the time to. She went above and beyond, and like really above and beyond. She made sure I was seen and not judged. She helped me get my first apartment after being homeless, and that's something I will never forget. This whole journey has shown me there are people still out there that genuinely care and who wants to see you win. And Charlene helped me rebuild my confidence and helped me believe that I deserve something stable and something safe. And because of her, I finally feel like I can breathe again. I'm grateful every single day that she has crossed my path. I just feel like, some people, can't trust people, and I feel like, sometimes you have to do that. Sometimes you have to, trust that, it's people out here that have the same heart as you. Yeah, all I can say.
That's amazing. Stories like Jayla's tell the real story of our work, and we're so proud to help patients take care of their health and wellness so they can live the fulfilling lives they want. Thank you again, Jayla. Now we're going to get the audience involved. Please welcome Darius Anderson of SSHCO's Community Advisory Council.
Good morning. I'm Darius Anderson. I'm a member of the SSHCO's Community Advisory Council, and I get to do the fun part. We're going to do something a little different right now. We know town halls can be a lot of listening, but today we want to hear from you. Not just in the Q&A that's coming, but right now we are bringing some live quiz questions. You'll be able to answer and vote right from your screen. You'll see the audience responses, but not individual responses. It will be all anonymous. And the person who gets the most quiz questions right will win some swag. Let's get right into it. Question number 1. Let's start with your test of diabetes prevention knowledge. Which of the following helps prevent type 2 diabetes? Eating more fiber, staying active, maintaining a healthy weight, all of the above. Give you guys a couple seconds to answer. Cool. It's all of the above. Staying active, eating well, and maintaining a healthy weight. I know all those things are easier said than done, but with our community health workers, help get people connected with food programs, health screenings, and more because prevention is possible when you have the right supports. We can go right into question number 2. True or false? High blood pressure always has visible symptoms you should pay attention to. Give you guys a couple seconds to answer. Cool beans. That one is false. High blood pressure is called the silent killer because it can have no symptoms. That's why regular checkups matter, and that's why SSHCO can help provide people connected with primary care providers and offer blood pressure screenings at community events. Let's get right into question number 3. Which of these are a common barrier to healthcare on the South Side? Transportation, insurance, trust in the system, or all of the above? I see the chat. Cool, cool. Is all of the above. Southside Healthy Community Organization was built to tackle each of these barriers by getting people to their appointments, helping with paperwork, and being a familiar face and a listening ear. Next up, let's get right to question number 4. Southside Healthy Community Organization services are free, a sliding scale, or insurance only. Cool, cool. The answer is A, free. We are funded to serve Medicaid members and those who are uninsured. So don't let either of those be a reason for not reaching out. On to our last question. What does CHW stand for? Chicago Health Ward, Community Hospital Workers, Community Health Worker, or Care Health Watcher? Cool beans. The answer is C, community health workers. Community health workers and our nurse care coordinators are the ones who do the work of the SSHCO on the ground. They're trusted. They check in, they make plans with you, and they connect the dots. They're amazing and ready to help. So visit southsidehealthcommunity.org if you're ready to get started. And that's it. Thank you for playing and sharing your own thoughts. If you got all of the quiz questions right, we'll reach out to you after the town hall and get you your swag. In a few minutes, you'll get to ask us questions, so drop your questions in the Q&A. But first, I'd like to send it over to Dwayne, our Manager of Human Resources, for an announcement about some job openings at the SSHCO.
Thank you, Darius. Good morning, everyone. As mentioned, my name is Dwayne Javier, and I'm the Manager of Human Resources here at SSHCO. And I get the exciting opportunity to announce that we are hiring. For SSHCO to continue serving our Southside community and creating the impact that you've just heard about, we need to expand our team. We're actively recruiting passionate, committed people who want to be part of truly transforming health outcomes. The positions we're adding are to be a direct investment in the quality of care and leadership here at SSHCO. We have immediate, high impact in both executive and specialized clinical roles, including Vice President of Population Health, Director of Value-Based Agreements, Director of Quality Improvement, Bilingual RN Nurse Care Coordinator, and Community Health Worker. These specific roles and many others across the organization are essential to our ability to deliver coordinated care. So if you're passionate about what SSHCO is achieving, or if you know of someone who shares our values, please send them our way. To see the full list of all open positions and to apply today, please visit our website at southsidehealthycommunities.org. And with that, I'd like to turn it over to Thaddeus Wright, our Program Manager of Social Determinants of Health at SSHCO.
Thank you so much, Dwayne. Kimberly has said a few times this morning that all of the positive outcomes and changed lives would not be possible without our partner. One of our strongest partners relationships that we have built so far has been with Phalanx Family Services. They've been on the South Side for over 20 years, and their work goes far beyond job training to include holistic support, like digital literacy, mental health services, and helping residents get a bus pass so that they can get to and from work. Today, I'm thrilled to welcome Laura Bailey, Director of Operations at Phalanx, one of the fiercest advocates I know when it comes to connecting workforce and wellness for our community members. Laura, thank you so much for being here.
Thank you so much, Thaddeus, for that introduction.
Absolutely. Let's get started with the basics. For those new to Phalanx, what does your team do on a day-to-day basis, and how does that connect to health?
So on a day-to-day basis, one, Phalanx is a workforce development solutions agency. And so our work really brings community together around workforce development, individuals that are looking for vocational training, opportunities to connect directly with employers. As you mentioned, our digital literacy program prepares individuals for this digital world. Everything now works around computers and laptops and apps. And so we really want to prepare not only our community residents, but specifically our seniors so that they can navigate in today's world. Financial literacy, job coaching and preparation, vocational training and skills assessments, and then, of course, wraparound support, which SSHCO is so much a part of.
Absolutely. Thank you for that. And so navigating life, right? And so that brings me to my next question. So let's tackle a very timely question. We're coming up on November 1st, and a lot of people are worried that they may not be able to receive food stamps or their SNAP benefits. Can you talk about that and what people can do?
So one of the things that we're offering to community residents is now every Monday and Wednesday, Phalanx will be hosting on-site info sessions for those that may be impacted by the reduction or no food stamps for the month of November and maybe even beyond. And we're hopeful that that is not the case. But Phalanx has now put together a resource directory that we can literally physically hand out, or email out to residents so that they can know where they can go to get food support. And then, of course, you guys, our SSHCO partners, has really directed us to be able to be in a position to enhance our dollars that we would be able to provide to community residents based on their family size. So you guys have been very intentional in preparing for what may come in hopes that it may not, but it's better to be prepared and rather than reactive.
Absolutely. Thank you so much for that. My next question is, how has the partnership with SSHCO shifted or strengthened the way you support residents? Are there things you can do
phenomenal.
now? And I can attest to that, right? Are there things you can do now that weren't possible before?
Absolutely. And so Phalanx, again, being a workforce development agency, when COVID happened, we literally were pushed into Department of Public Health Services, where we're now able to address chronic diseases and how that really impacts our community. Our partnership with you guys, SSHCO, has now allowed to be you guys on site with us every Tuesday. Yes, I'm putting in that plug, beginning at 9:30 for referrals and resources. And so now community residents can come in, get questions asked and answered, get referrals for a primary care physician, get referrals for wraparound support. These were things that we were not able to do without SSHCO. So we are really thankful. Our community residents are thankful. They don't have to go into the emergency room or department to get some very basic things answered for them. They can come on site in a trusted organization right at their back door and get questions asked and answered. So even the diabetes screening or the blood pressure screenings, which allows us to speak directly to chronic diseases that are happening in our community, you guys have been so much a part of us helping to get information and resources out. So again, thank you.
No, thank you for that. Thank you for that. And so my next question, it goes along the line. When I first started with SSHCO, my chief executive officer, Kimberly Hobson, will always say that a patient is not healthy with just healthcare services, right? That they need those SDOH resources. So in our work, we often say that health isn't just what happens in the doctor's office. It's what happens when you don't have food or housing or transportation. From your perspective, what is the biggest unmet need right now on the south side of Chicago and the communities that you serve?
Yeah, so while we recognize all of the services that Phalanx offer are paramount, we do recognize that a holistic approach to serving residents is also paramount, and there's such synergy and alignment with SSHCO and Phalanx. We look at actually food being the biggest insecurity now around the far south side of Chicago. And with this initiative, it's allowing us to immediately meet a need of an individual walking through our door, where they may walk out now having resources where they know that they can have a prepared meal or purchase a meal for their families, even for that evening. That is huge in times where now so many things are uncertain, when they know that they can come in and receive these services and not have to wait days or weeks, right, through a long application process. But it's an immediate service that we're able to provide as a result of this partnership. So definitely food would be one of the biggest things that we're addressing now.
Absolutely, absolutely. So I have two more questions. I think these
Sure.
are the important questions. One is about trust, and the other one is about our opportunities ahead. Right. My next question is, what role does trust play in this work, especially for residents who have had systems fail them before?
So trust is I would say, the essential piece, right? So when you've had residents have systems drop for them, when their need is such, it's a critical time. Sometimes it's a matter of feeding your family or not feeding your family. It's a matter of shelter or not being sheltered. So trust is one of those essential pieces. And I would like to couple that with consistency. And so being able to offer the services on a regular basis where they know every Tuesday they come in, they're going to see SSHCO represented in our reception area for referrals. The consistency of that is really big, right? And then holding true to what you say. When you say that you can come in and receive these services, receive the referrals, or get, the gift card for food that day, that is paramount. And then the trust actually is more established. When individuals come through our doors, we are really intentional on what we say we do. And because of SSHCO, we're really able to continue the support around food insecurity within the far South Side community. And wraparound, let me say, and the wraparound services. So it's not just food, but it is connecting them to physician care or housing support or utility assistance, or job training services, mental health services. So there are a lot of things that go into when we talk about the person's health. We recognize this is not just their physical condition, but we're addressing them in a holistic approach.
Absolutely, absolutely. And Lauren, you and I always talk about the wraparound services that we provide to communities. So looking ahead, what's one opportunity or idea you're excited about when it comes to deepening this kind of cross-sector partnership?
I am so excited. Even this week, SSHCO has decided to roll out food initiatives that's really going to more directly support families. While we've been doing this since this inception of this partnership, because of what's happening, SSHCO has decided to really increase the dollar amount that we're able to support residents with as it directly relates to their family size. And so I'm excited about that, especially given what may happen on November 1st. We're able to address the community, meet a need immediately with support, and not, again, this long application and this waiting process. When I need to feed my family, I need to do that today. And being able to do that immediately just really speaks to the testament of all of us being cognizant of what is happening to our residents and how do we support them.
Yes, absolutely. Thank you so much again, Laura, for taking your time and conversing with me today. You always bring it back to what matters, and we're proud to be doing this work with you. And now it's your turn. To guide us through our audience Q&A, I'm happy to hand it over to my colleague, Wendy Thompson, Chief Executive Officer at Friend Health and a member of our board of directors. Wendy, it's all yours.
Thank you. Thank you, Thaddeus, and thank you, Laura. That was such an insightful conversation. I am very pleased to be here today, and this is frankly one of my favorite parts of the town hall. It's when we get a chance to hear directly from you, and we have a chance to hear your questions and to answer them. So if you haven't done so already, please drop your questions in the Q&A, and we'll get through as many as we can. So let's take a look here. Okay. The first question we have here is, what does SSHCO do for pregnant mothers? Going to hand this one off to LaShandria.
First, thank you for that question. So, the SSHCO supports pregnant and postpartum mothers through comprehensive maternity care. We provide prenatal and postpartum education, doula services in partnership with Chicago Birthworks, and subsidize ultrasound costs. We also connect women to OBGYNs and maternal fetal medicine specialists for high risk pregnancies while addressing broader needs like mental health conditions, transportation, housing, and food access to ensure holistic care for those pregnant moms.
Wonderful. Thank you for that. Okay, we have another question. How can churches and faith-based organizations partner with SSHCO? Thaddeus, can you help us with that one? You may be on mute.
I think I'm having some technical difficulties.
We
And
can hear
so
you.
I'm sorry. And the question was,
Sure. How can churches and faith-based organizations partner with SSHCO?
yes, so churches and faith-based organizations can partner with SSHEO by reaching out to the SSHEO by either calling that number, the 872 number. Give me 1 second. I want to make sure that I have that handy for you all. They can either call the 872-274-4688, or they can call my cell phone number, my direct cell phone number, 773-562-0975, or they can simply email me. My first name, Thaddeus, Thaddeus, .Wright, last name Wright, like you're right, but with a W at the beginning, at southsidehealthycommunity.org. Again, Thaddeus.Wright at southsidehealthycommunity.org. And the development office will reach out to them, and we'll set up a meeting and connect them and try to best partner with collaborations and services.
Wonderful.
Wendy,
Yes.
can I jump in? This is Kimberly.
Absolutely.
I would love to tell you and give you an example of what we've done in one church or several churches. We actually will go out to the churches. We go to the churches. We've attended services. We've talked to the parishioners in the churches about the Southside Healthy Community Organization. And we've also set up tables after church services. And we serve the residents in the community and in those churches right after the church service by answering questions, getting them signed up for services, and so forth and so on. So that's a practice that we have too. This is one that's near and dear to my heart, as many of you may know or not know, but you'll know now that my husband is a pastor on the south side of Chicago, Woodlawn AME Church on 64th and Evans. And so this faith-based connection to the SSHCO is near and dear to my heart. And that is definitely a part of what we do. And it's a great place to meet the community and serve the community.
Wonderful.
Absolutely, Chief. And we're no strangers to that either. So I just definitely wanted to piggyback on that. Absolutely. Thank you so much.
Great. And Kimberly, don't go away. We have a question for you here.
Okay.
Can holistic practitioners connect with the SSHCO?
So let me tell you, I think when Laura from Phalanx was talking, she talked about holistic care. And we talk about taking care of the whole person. So if we're taking part of one part of the person and not the other part of the person, of course, there's some benefit to that. But taking care of the whole person is really critical to the SSHCO. What I can say is our CMO, that's Dr. Sophia, she is not with us today, but she has a passion for holistically taking care of the person. So whoever put that question in there, I hope you guys have documented that, because I'm going to ask you to reach out to the SSHCO, and I would love to connect you with our CMO, Dr. Sophia, to have a conversation about what your thoughts and ideas may be around that.
Wonderful. Thank you. And I see here that we have a request for Laura's contact information. Is that something that we can share in the chat?
Absolutely. I have put it in the chat, and Phalanx Family Services is located at 837 West 119th Street, In Chicago, of course, the contact number is 773-291-1086. There is ample parking. We are very accessible by public transportation, and our office hours are from 9 until 5 p.m. We look forward to servicing you.
Great, thank you. Okay, let's see. Okay, we have one here regarding home care providers. The question is, how can home care providers partner with SSHCO?
I'm sorry, Wendy, can you repeat that one again?
Oh, absolutely. How can home care providers partner with SSHCO?
So that's a great question. And so my advice would be we're always looking for ways to partner with, as Kimberly mentioned, faith-based organizations, but also other organizations within the community. And so a lot of our relationships become really unique. So it would be great to have a one-on-one conversation with whom asks that question. So I encourage you to reach out to the phone number and or the put a request in to the website address, and we can reach out to you directly, as Kimberly mentioned, as well as with the faith-based organization.
Wonderful, wonderful here. And there was another inquiry regarding contact information for phalanx. And so thank you, Laura, and Stephanie, and several others for listing that. So if you have questions regarding the phone numbers or addresses or contact information, they are listed in the chat for everyone. Okay, another question is, and I think this is for you, LaShandria. What are common health challenges that you see in our patients?
Wow. So the most common health challenges we see, they include chronic conditions from high blood pressure, diabetes, and of course, asthma. This includes mental health conditions concerns such as depression and anxiety, and barriers to care like lack of insurance, transportation, or stable housing for those social concerns. This is exactly why we focus on addressing both medical and social needs, because health outcomes are shaped by more than just the clinical care.
Great. Okay. Thank you for all the questions here. We'll keep moving along. I think this is for several members of the team. What initiatives, programs, or partnerships is SSHCO interested in participating that may not currently be in place?
I'll start with that one. And then, LaShandra, if you have something to share or others can share as well. We are interested in partnering with community-based organizations. They can be healthcare or they can be healthcare organizations, but they can also be organizations like Phalanx that do workforce development, that are food organizations. We partner with several food depositories and so forth. We're looking for places where our community health workers can actually get out of our offices sometimes and go into to the community-based organizations. They do not have to be healthcare. I want to continue to say that, because then what we can do is go inside of your community-based organizations like we go into Phalanx, and we can serve your constituents as they come through the door, and they can get another piece of what they need to remain healthy. And so not just healthcare, but they can be social services and so forth. Give us a call, give us the email. We're looking to expand in those areas to the extent that our staffing levels allow us to.
And I agree with that 1,000%, Kimberly. And I'll also add that any services that can support the parents of the patients that we follow or connect with. So this includes items for kids or for clothing. We know that oftentimes we have patients who are seeking support for their families or those that they are raising in the household, or furniture as well. So if there are any organizations out there that could help with those types of items socially, again, thinking about the holistic approach, that would definitely be great.
Wonderful. Okay. I see a question here. I'll start with you, Kimberly. And it's around growth and opportunities in the future. Are there opportunities in the future for programs that, can create low cost options for eyeglasses?
You know what? We don't have, I'll be quite frank, currently, we don't have an eyeglass a focus in what we do. What we will do, though, is that we mentioned earlier the number of referrals that we make to community within the community to meet the holistic needs of the patient. And so currently we're making referrals to organizations that can help with eyeglasses. And so that's usually where the eyeglasses come in, is that we will make referrals to organizations in the community that can assist with eyeglasses. We do the same thing for dental, even though that's not one of our specific focus areas, but I know that our partners provide dental services. So we make those referrals and ensure that our patients get to those services that they need.
That is wonderful and such a great point. And while not a question, someone from Chicago Commons provided their information there in the community, and they have resources for home care providers. And so the more the merrier. Let's see, we have another question. Are there physical sites for SSHCO?
So yes, we have a office location just for our staff. However, we are sitting within the communities that we serve at our FQHCs, right, or clinics right in your neighborhoods. So this includes places such as Friend Health, Near North, Health Center, St. Bernard Hospital, and Medical Office Building. And so that leads to also some of our emergency rooms if someone ever needs support, which may be Roseland Hospital, Jackson Park Hospital, and South Shore Hospitals are some of those ones. So within the collaborative sites in the areas of which we serve.
And if I can add to that, thank you so much, LaShandria, for that. I mentioned earlier that we are deployed into 21 clinic and hospital sites across the south side of Chicago, and we are on the ground. So we have physical sites that we're going into, and we also are in the community on the ground, community centers, all of those places serving individuals. And then at 7936 South Cottage Grove, those are our administrative offices. And we have lots of administrative staff that is their home.
Wonderful. Great. I see here a comment. This is why these conversations are so great, highlighting the work of Steve Johnson and Teamwork Inglewood, and just noting that they recently held a free vision screening and glasses event in the community. And for follow-up, his information is there in the chat. We have
Wendy, if I can add to that too, Teamwork Inglewood is on our board. Cecile, their executive director, I just wanted to give a shout out to her. She is a member of our board of directors, as Wendy is, and they do have several programs and efforts, and the SSHCO partners with Teamwork Inglewood on a couple of those programs that they provide.
Perfect. Okay, a few more questions here. Can someone, and this is for LaShandria, can someone sign up on behalf of a family member or a neighbor?
That's a really great question as well. Yes, someone can receive assistance with signing up for services on behalf of a family member or neighbor, especially if they are a legal caregiver or an approved family member. However, we do prefer that the individual signs up themselves whenever possible, so we can ensure their needs and preferences are heard and helped directly. But if someone needs help with that process, again, they can call us at that number that is in the chat and or on our website at www.southsidehealthycommunity.com. And one of our team members will probably reach out or be there to answer the phones.
Right. Thank you. Okay. Great. This is a question. Will there be anything to help patients enrolled in the program cover the first sliding scale fee for their first visit?
We're asking, is that question asking, will we cover that?
I think they're just asking for how would someone get support? What's additionally noted is that they've encountered patients who have had difficulty once they connected to healthcare providers, covering the initial cost associated with establishing care.
You know what? I don't know that I can fully answer that question. I will say, and we can get further answers for this, but what I will say for that particular question is that our partner federally qualified health centers, and we have 6 unique organizations that are FQHCs. They actually see patients regardless of their ability to pay. So I don't know if these residents are going other places other than the federally qualified health centers, but I do know that our FQHC partners, and Wendy is one of them at Friend Health, they will see patients regardless of their ability to pay. So if the patient cannot pay, and then if they can pay something, there is a sliding scale and so forth. If they are not at a federally qualified health center, I think we should do some digging, and maybe we can provide an answer out to that question in our to our listserv following this town hall meeting.
Great. Thank you, Kimberly. You're exactly right. There are multiple FQHCs across the South Side. Friend Health happens to be one that is near and dear to me. Our goal is to provide access to everyone. And so, regardless of your insurance status or your ability to pay, we provide services and we'll help figure out the rest. So, please encourage individuals to seek care, and the community health workers can help connect you to Frank Health or any of the other many FQHCs on the South Side. Okay. Sorry, they're coming in. What strategies can we employ to reinitiate relationships with partners who have been unable to respond or meet the needs of community members? We recognize it's a challenging time, so how do we reconnect?
You know, I mean, I think we reconnect by letting us know that you want to reconnect. And if you're talking about reconnecting with the Southside Healthy Community Organization, there's always an open door for us to have conversation, to network, to figure out how we can work together. But we also connect other organizations, other organizations outside of the SSHCO. We will connect them together if there's an opportunity for other organizations outside of the Southside Healthy Community Organization to partner. And so we're just not that one way. We are community. We want to connect the ecosystem. And so let us know what you have in mind, what you need, and we will sit down, have a conversation, and see how we can assist us, or you can even assist us and our patients as well.
Thank you. Okay. Are there any additional resources available for our 64 and over population outside of Department of Aging, since the Department of Aging is no longer able to assist in the way that they had previously?
One thing I would say is, our population that we serve is Medicaid and uninsured patients. About 16, 18, all the way through 64. Let me say that if we are in one of our sites and there is a person over 64 that needs something immediate from us, we will serve them as well. But I also want to say that there is a partner healthcare transformation collaborative, which is located at St. Bernard Hospital, and it is the Center for Better Aging. And if someone can kind of grab a link to their website. The Center for Better Aging is a great organization. It's a HTC. See, we even work together as HTCs, and they have all kinds of services for those that are aging and 65 and older. So that is a great organization that if you specifically are focused on the aging population, the Center for Better Aging at St. Bernard would be a great organization for you to connect with as well.
Wonderful. Thank you. And I see that the website for the
Thank
Center
you.
for Better Aging has been added to the chat for follow-up. Um, okay, here, I think we have time for a couple more questions. Okay, this one is for you, LaShandria. Will there be other resources for patients that may need equipment, such as blood pressure monitors, and other items that may or may not be covered by insurance? Some patients have had challenges because they've been told to pay out of pocket.
Absolutely, and I take that question on with a smile. And some of you all may already know about this, but what we are currently doing is trying to identify what some of our Medicaid organizations that we work with, what they provide, what they don't provide, so that we can then find, well, how else can we meet the needs of the community? So we are working on and currently have a blood pressure monitoring program, for example. And so what we are doing is those patients who we have identified with elevated blood pressures or have a hypertension diagnosis, we are working to improve our program of deploying blood pressure devices so that we can have patients monitor their blood pressures at home via a Bluetooth device and or a manual device that they can begin to use to stay engaged with our community health workers and or nurse care coordinators to help in reducing. So the blood pressure device is where we have started at, and then more information to come about any other additional programs as we continue to look further into the needs of the community.
Great. Thank you. And it's amazing how time has flown. And so I think we've come to our final question here. And LaShandria, this one is for you. The question is Southside Healthy Community Organization actually providing services or care, or is the role of the SSHCO to connect patients to existing service providers?
That's a wonderful question as well. So we want to be looked at as the hub for the South Side, where we help you navigate and connect you to all of your medical and or social needs. So we do not or are not a physician's office ourselves. We are not the community-based organization ourselves. However, we want to be that number one support on the South Side that can lead and guide you and hold your hands in helping you navigate the system, as we know, understanding and knowing where those the help is at. We know it's sometimes challenging, and we want to be there to support you to lead you in the right directions.
Wonderful. Wonderful. So I just want to thank everyone. These questions were amazing. The engagement was very impressive, and thank you for your high level of participation. So with that, my time has come to an end, and I will pass it to you, Kimberly.
All right. Well, thank you so much, Wendy, for guiding us through this Q&A. If I can just have another moment or so. Thank you to Nancy Tao of the Healthcare and Family Services, Laura Bailey of Phalanx for joining, and thanks to all of you for taking your time this morning to learn more about the SSHCO and from where we've come and where we are right now. And so, you've heard the numbers, you've heard the stories, and you've heard the voices behind the impact that we've shared. And if there's one thing I hope you'll take away, it's that the model works. The Southside Healthy Community model works. When we center the whole person, when we meet people where they are, and when we wrap care around their lives, we see real change. And so not just in healthcare statistics and all of that, but we see change in their confidence levels, in their stability, and in their trust in the community. And so if you want to partner with us, you can sign up for services, refer someone you know, or fund this work. We want to hear from you. Visit us on our website at southsidehealthycommunity.org. Follow us on social media as well. And please don't hesitate to reach out to us. We are looking for all of these reach outs. And on behalf of the whole SSHCO team, our board of directors, and our incredible partner organizations, Thank you again. Let's keep pushing together for the healthy, thriving South Side our residents deserve. We'll see you next time.